Hello, I'm Dr. Sathish Kumar. I'm an endocrinologist, work at Aster RV hospital, and basically today I'm going to talk one of the main conditions which we deal with almost every day, and that is gestational diabetes. Gestational diabetes, like any other regular diabetes, is a blood sugar disruptive state during pregnancy. As you are aware of, most of our cells in the body require sugar for its energy. Even though it requires energy, it may not be in a position to utilize it in a proper way because of the either deficiency of insulin or the ineffective aspect of insulin on most of these cells. That develops in pregnancy. That is why it is called gestational diabetes. Most of the time after delivery, gestational diabetes disappears or subsides by itself. However, majority of these patients would be at high risk of developing type 2 diabetes in the next 5 to 10 years unless we take care of lifestyle conditions, weight and other things. As far as gestational diabetes itself, generally we try to identify this condition or diagnose this condition by around 6th or 7th month of pregnancy, what we call 24 to 28 weeks of pregnancy. If a patient has had gestational diabetes in previous pregnancies or has a family history of significant diabetes in the family members, or if the patient is overweight or obese, then the gynecologist or the endocrinologist would try to do the diagnostic test even earlier than 6 months. The main reason for identifying and treating this condition is very important for you as a patient and for us as professionals. The reason is, if the blood sugar control is not good during pregnancy, your baby can get bigger than what it should be, or a patient can have premature birth, and while delivery, these babies can get hurt by itself while passage through the birth canal, or the delivery itself can hurt the mother because of the huge size of the baby. These are few of the problems. And after delivery, baby can have very low blood sugar and a little bit of extended period of jaundice, and hence babies can require intensive care therapy. In order to prevent all these complications, we try our level best to stabilize the blood sugar. When we take diagnostic part, generally your gynecologist, or if you come to endocrine department, we do a basic glucose challenge test. If the test result is abnormal, then we move on to do a proper second step of oral glucose tolerance test. It is a test in which we take fasting blood sugar and then we give glucose water at a certain calculation, and then we continue to do hourly blood sugar. There are very clear national and international guidelines to diagnose the condition. Once we diagnose it, we sit with the patient and discuss everything about how we can manage gestational diabetes without any medication. If lifestyle measures, diet condition and physical activity does not control blood sugar in a very short span of time, maybe 1 or 2 weeks, depending upon the level of blood sugar, we decide to move on to medication. Either it can be tablet. Most of the time we encourage patients to take insulin therapy. Once blood sugar comes under control, we reduce the frequency of blood testing. During this period, you may have to visit your endocrinologist or diabetologist a little bit more frequently than what you normally do. Until delivery, we manage either with lifestyle changes or with tablets or with insulin, and our ultimate aim is to make sure that baby is going to be growing in a healthy condition and it would be delivered in a healthy condition. After delivery, your gynecology team will continue to monitor for the next 24 to 48 hours to make sure that your blood sugar is back to normal without any medication. Once delivery happens, we always try to do further investigation to see that whether the gestational diabetes has subsided totally or is there any blood sugar related problems persistent. That would be done 2 to 3 months after delivery. If blood sugar is totally normal, then we continue to monitor once in 2 to 3 years and for up to 10 years and some conditions throughout life. One thing all of you should remember, that you have to be concentrating on weight management, low carbohydrate diet, physical activity and stress management in order to prevent or treat gestational diabetes. And all these management aspects, diagnostic aspects, we do it at Aster RV Hospital, which is situated in JP Nagar, and our department is always there to help you out. As endocrine team, we are there for your help. Thank you very much.